Hi, it's Patrick Hutzel from intensivecarehotline.com, where we instantly improve the lives for families of critically ill patients in intensive care so that you can make informed decisions, have peace of mind, real power, real control, and so that you can influence decision making fast, even if you're not a doctor or a nurse in intensive care. This is another episode of Your Questions Answered, and in last week's episode I answered another question from one of our readers, and the question last week was: my sister is in intensive care after a car accident with multiple fractures. The doctors want us to pull the plug. We want to keep going. What are our rights? You can check out the answer to last week's question by clicking on the link below this video. In this week's episode of Your Questions Answered, I want to answer another frequently asked question from one of our readers. And the question this week is: why is a critically ill patient not waking up from an induced coma? One of the biggest frustrations for families of critically ill patients in intensive care is that they are having a loved one critically ill that's in an induced coma and is not waking up. It's one of the most frustrating situations families in intensive care are facing, because their loved one all of a sudden is unable to communicate with them and to the outside world, even though they are right in front of them. I can't tell you how many families in intensive care come to us on a daily or weekly basis with this number one frustration, and they're all saying the same thing. And they say some things like: my loved one is in intensive care on a ventilator, they are in an induced coma, and they're not waking up. Why is that? Or they're saying something along the lines of: my loved one has been in an induced coma and on a ventilator for 2 weeks now, and they have been out of the induced coma for the last week, and they're still not waking up. What should we do? When will my loved one wake up? Our role here at intensivecarehotline.com really is to not only answer your questions, but even more so to give you and your family perspective. Perspective is so important when you have a loved one critically ill in intensive care. And besides answering your questions, I believe giving you perspective of what's happening when you're having a loved one critically ill in intensive care is absolutely crucial. Without having perspective when you're having a loved one critically ill in intensive care, it's very easy to lose sight, it's very easy to lose hope, and it's very easy to lose faith. Therefore, my first response to this question of why is a critically ill patient not waking up from an induced coma, let me tell you this, and I know it's probably not what you expect, and it's probably not what you want to hear. Your loved one will wake up when the time is right and when they are ready for it. Let me say this again because it's so important. Your loved one will wake up when the time is right and when they are ready for it. Yes, and I can hear you saying, but my loved one has been in intensive care now for 2 weeks and all they do is twitching their eyes or moving their hands or their fingers, and they even try and squeeze hands on occasion. Shouldn't they be waking up by now? One of the biggest challenges in life in general is that we all like to achieve our goals with certain deadlines that are self-imposed. For example, we want to lose weight, or we want to get a promotion or whatever, and we want it within certain time frames. And if we apply the same framework and the same mindset and the same thinking to waking up after an induced coma in intensive care, we are seeing very quickly that this approach is often doomed to fail. Waking up in intensive care after an induced coma is a process and not an event. So what do I mean by that? Waking up after an induced coma in intensive care is like switching on a light with a dimmer and not with a switch. It's often a slow process that can take days or sometimes even weeks. In case of head and brain injuries, it can sometimes take months. the 3 P's. Patience, positivity and persistence are often your biggest assets when it comes to waiting for your loved one to wake up after an induced coma. So, why is your loved one not waking up after an induced coma? There are a number of reasons why your critically ill loved one hasn't woken up after the induced coma yet. And there is no one-size-fits-all when it comes to not waking up after an induced coma. There simply is no such thing as exactly predicting when your loved one will wake up after coming out of an induced coma. Let's look at some of the most common reasons what causes a delay for your critically ill loved one to wake up after an induced coma. So for example, your critically ill loved one has been heavily sedated with either midazolam, which is also known as Versed, and has been on morphine or fentanyl for prolonged periods of time. Usually anything above 7 days is prolonged. Also, your critically ill loved one might have had anesthesia for surgery before or during their stay in intensive care. Or your loved one may be having complications such as severe sepsis, kidney failure, liver failure, stroke, multiple trauma, head or brain injuries, ARDS or lung failure, ECMO, etc., etc. And your critically ill loved one might have had a cardiac arrest as well. And what also increases the risk of not waking up quickly after an induced coma is if your critically ill loved one is above the age of 65. Now, as a rule of thumb, age can be a factor, but doesn't necessarily have to be a factor when it comes to a delay in waking up after an induced coma. You can also check out some related articles and videos about this topic. So one article and video would be how long does it take to wake up after an induced coma, and the other one is how long can you keep a critically ill patient in intensive care in an induced coma. So go and check out those articles and videos, and I'll put some links below this video in the written version of this blog. Again, there is definitely a higher chance that with increasing age, waking up after an induced coma is delayed. However, it doesn't have to be. I have seen critically ill patients waking up after an induced coma very quickly if they are above the age of 65, and I have also seen critically ill patients below the age of 65, quite young patients, that certainly don't wake up in a time frame that's expected, and there is often a delay even if there's younger people. Again, there is no one size fits all. But the biggest challenge is often that families in intensive care expect their loved ones to wake up quickly after sedatives such as propofol, also known as Diprivan, and or midazolam, also known as Versed, have been taken off. Please keep in mind that with the sedatives being given for the induced coma such as propofol or Diprivan and or midazolam or Versed, your critically ill loved one is usually also getting opiates or pain relief such as morphine or fentanyl. The combination of sedatives and opiates is necessary to be able for your critically ill loved one to tolerate mechanical ventilation and the breathing tube in an induced coma. It's very painful and uncomfortable to be able to tolerate mechanical ventilation and the breathing tube without being induced into a coma. There is no such thing as mechanical ventilation without an induced coma and vice versa. One goes with the other, period. There's of course always the odd exception to the rule, such as when people are in a natural coma after severe head or brain injuries, but in 99% of the cases, induced coma is simultaneously followed by mechanical ventilation with a breathing tube and vice versa. And because sedatives and opiates accumulate in the body and are not getting out of the body system straight away after they have been taken away, there is often a delay in waking up. Furthermore, there is also a difference that is important to notice when it comes to sedation and induced coma. Most critically ill patients, when first induced into a coma, are sedated with a drug called propofol, also known as Diprivan. And by the way, you might also check out some ebooks that I wrote about this topic. One ebook is the 5 mistakes you are unconsciously making if your critically ill loved one is in an induced coma and is not waking up. And the other ebook is the 10 answers to the 10 most frequently asked questions when your loved one isn't waking up after an induced coma. Again, the links to these ebooks are in the written version of this blog below this video. So, moving on. Propofol or Diprivan is a short-acting sedative, and it works very quickly after being given, and it also stops working quickly when taken away. Therefore, critically ill patients after an induced coma that have been on Propofol or Diprivan should wake up quicker, often within minutes or hours after it has been seized. That's very often the case in short-term induced comas. And that means 72 hours. Taking away Propofol or Diprivan doesn't guarantee waking up quickly. One of the reasons why waking up quickly after the use of a short-acting sedative such as Propofol or Diprivan is not being guaranteed is simply that opiates or painkillers such as morphine or fentanyl can delay waking up as well. Critical illness in intensive care often comes with a lot of pain attached to it because of either the critical illness itself or because of the treatment attached to it. Therefore, adequate pain control is paramount and also has its undesired side effects. Morphine or fentanyl being given intravenously during the induced coma has sedative effects too, and often delays waking up as well. Besides morphine and fentanyl being strong painkillers and having a sedative effect, they also have side effects such as respiratory depression, meaning that when your critically ill loved one is slowly waking up, they are not breathing up as quickly as they should because of the morphine or the fentanyl having those undesired side effects. Therefore, waking up after an induced coma also needs to go hand in hand with breathing up on the ventilator. Besides waking up and following simple commands such as squeezing fingers, opening eyes or poking out their tongue, your critically ill loved one also needs to be able to breathe independently before they can be taken off the ventilator. And if your critically ill loved one is sedated for more than 72 hours or even for longer, midazolam, also known as Versed, is often being the sedative of choice because it's a longer-term acting sedative and has better effects for longer-term induced comas. When it comes to waking up from the induced coma, midazolam, also known as Versed, needs to be more gradually reduced compared to Propofol or Diprivan, simply because it's a benzodiazepine, also known as benzos, and benzos can be addictive in nature. Therefore, a gradual weaning of the midazolam or Versed when coming out of an induced coma should be followed in order to avoid any withdrawal symptoms. There should also be a gradual and not abrupt reduction in opiates or painkillers such as morphine or fentanyl, as they can be addictive in nature too. Therefore, any abrupt cessation of morphine or fentanyl can cause withdrawal symptoms as well. With that in mind, you can see that the combination of a prolonged induced coma with midazolam and opiate painkillers such as morphine or fentanyl will cause a delay in waking up. They are very strong and potent drugs, and they take their time to get out of the system. On top of that, there are other reasons, just simply that your loved one is battling a critical illness. Your loved one just simply needs time to recover from such a massive event like a critical illness. Therefore, even though they may be more awake after they are slowly coming out of the induced coma, your critically ill loved one may still need more time to wake up, simply because they are recovering from the critical illness. Imagine if your loved one just had such a massive event like a cardiac arrest, major trauma, cardiac surgery, stroke, ARDS or lung failure, pneumonia, Guillain-Barré syndrome, seizures, heart attack, sepsis, liver failure, or ECMO, of course your loved one will need time to wake up. Again, waking up after an induced coma is like switching on a light with a dimmer and not with a flick of a switch. Keep that in mind at all times. So, how can you become the best advocate for your critically ill loved one, make informed decisions, get peace of mind, control, power and influence quickly whilst your loved one is critically ill in intensive care? You get to that all-important feeling of making informed decisions, get peace of mind, control, power and influence when you download your free instant impact report now by entering your email below. In your free instant impact report, you learn quickly how to make informed decisions, get peace of mind, real power and real control, and how you can influence decision making fast whilst your loved one is critically ill in intensive care. Your free instant impact report gives you in-depth insight that you must know whilst your loved one is critically ill or is even dying in intensive care. Sign up and download your free instant impact report now by entering your email below. In your free instant impact report, you learn how to speak the secret intensive care language so that the doctors and the nurses know straight away that you are an insider and that you know and understand what's really happening in intensive care. In your free report, you will also discover how to ask the doctors and the nurses the right questions, discover the many competing interests in intensive care, and how your critically ill loved one's treatment may depend on those competing interests. How to eliminate fear, frustration, stress, struggle, and vulnerability even if your loved one is dying. You get 5 mind-blowing tips and strategies helping you to get on the right path to making informed decisions, get peace of mind, control, power and influence in your situation. You'll get real-world examples that you can easily adapt to your and your critically ill loved one's situation. How to stop being intimidated by the intensive care team and how you will be seen as equals. You'll get crucial behind-the-scenes insight so that you know and understand what's really happening in intensive care and how you need to manage doctors and nurses in intensive care, and it's not what you think. Thank you for tuning into this week's Your Questions Answered episode, and I'll see you again next week in another update. Make sure you also check out our blog section for more tips and strategies, or simply send me an email to support@intensivecarehotline.com with your questions. Or you can call me, find international phone numbers on our contacts tab. Also, check out our ebook section where you get more ebooks, videos and audio recordings, and where you can also get one-on-one counselling and consulting with me via Skype, over the phone or via email by clicking on the counselling tabs. This is Patrick Hutzel from intensivecarehotline.com, and I'll see you again next week in another update.